Hi, I just wanted to discuss with you something that you probably are hearing people talk about. You have all of these people out here that are so afraid, and they keep saying that President Trump is going to cut programs like Medicaid and Medicare and Social Security. First of all, in this video, I would like to give you some information about the fraud, waste, and corruption in the Medicaid and Medicare industries. And I want you to please promise me something. Please comment on it and please share it with the people that you know, so that people will stop saying that they're cutting Medicaid and Medicare.
I want to go back to DOGE just for a second. Earlier, the subcommittee headed by Chairman Marjorie Taylor Greene, her and her staff discovered $2.7 trillion in improper payments to Medicare, Medicaid, overseas, to people who should not have gotten it. Some of this room might have missed that press conference. Can you elaborate on what the president is thinking at this point?
Well, again, that's another example. There's a very long list of the fraud, waste, and abuse that DOGE is identifying on a daily basis.
When DOGE audited the Medicaid and Medicare systems, they found out that they were distributing $2.7 trillion to people that were overseas. Now, everyone knows that there's no one overseas that qualifies for Medicaid and Medicare. And I had a few people, when I've said that before, they were like, well, what about the military? The military is on a totally different budget. Their money comes from the Department of Veterans Affairs. It does not come from the Medicaid and Medicare programs that are under Health and Human Services. Listen to me, $2.7 trillion. That money was sent, they said, to people overseas, although no one qualified for it. So it makes you wonder, where did the money go? That money had to go somewhere. Where do you think it went? The money circles. They say it's sent overseas and then it comes back to whom? Is it the people that work in those bureaucratic agencies? Is it someone in Congress that's getting a payoff? Who is it? Let me just give you a little information. This is something they said. They had $3 billion in fake claims that were exposed. $3 billion in fake claims. $30 billion in terminated contracts. And Health and Human Services was leading the charge with $1.7 trillion in cuts that they have recommended because of all of the fraud in Medicaid and Medicare. And for all of the people out here that always pretend, what do you mean fraud? Let me just listen to this story. It is really kind of unconscionable. Listen to what they're saying.
Somebody alert DOGE. We've got another drug the Medicare is getting absolutely gouged on. It is icosapent. In 2022, Medicare got this prescription 2.3 million times, and they paid an average of $479 each, which brings the total spent to $1.1 billion in only 1 year. However, like every drug I've talked about, it is a low-cost, widely available generic medication. At my pharmacy without insurance, that same prescription costs $50. At that price, Medicare could have paid for every single prescription in the country for only $120 million. That means Medicare wasted over $1 billion just because they are overpaying for this one medication.
This pharmacist is saying that Medicare is paying $479 for a drug that only costs $50. How many times do you think that happens? It happens all the time. And for Americans, let me just remind you of something. Every time I do a video like this, I want you to know where the money comes from. 90% of the money that pays for everything in our federal government comes from you. And everyone that you know that goes to work. 90% of the money comes from payroll taxes, and it comes from income taxes and other taxes, like maybe property taxes, consumption taxes, and things like that. Understand, this is your money. So when there is fraud, the fraud is on you. They are ripping you off. And who is it that I'm talking about when I say they? It always starts with the bureaucratic agencies. That's who I always blame first, because someone in those agencies are approving someone is approving all of these payouts. Someone very high up is also approving how much they're paying for medications. Someone is approving how much they're paying for all of the treatments that people are getting that's on Medicaid and Medicare. Someone out there is not looking to get the best product at the best price because they're paying for all of these drugs, all of these pharmaceuticals, and there are always generic brands that are far cheaper. But nobody cares. Nobody cares because no one is held accountable. Now listen to what President Trump has to say about all of the fraud, waste, and abuse in Medicaid and Medicare. And for all of the people out here that are saying that he is cutting it, $2.7 trillion was sent to people overseas, and nobody overseas qualifies. $1 trillion. I didn't say billion, and I did not say million. I said trillion. We need to stop all of this, and it needs to stop now.
Waste, fraud, and abuse. There's tremendous waste, fraud, and abuse. There's incompetent things put in. We have illegal aliens that are multiple killers with multiple murder records getting Medicaid. I don't think anybody minds if we cut that. The Democrats, on the other hand, are going to destroy it because they're going to leave these people on. We're cutting three things: waste, fraud, and abuse.